And we put this lecture together about a week ago because we recognized we need to start training our people to respond to COVID stuff. And then it became this very sonic thing. So, in fact, I'm teaching casinos tomorrow. I'm going to meet the Rotary Club on Thursday. So I got really popular for making a PowerPoint, which is cool. It's never happened before. Nobody's paying me for it, though, which is really unfortunate. So the monetization side sucks. But basically, I'm going to give you a little bit of background about COVID and about what's going on in the last couple of weeks and couple of months, how it's changing the way Government Ambulance responds to calls, and how I think it's going to change the way Timberline responds to calls to keep you guys safe. And then give you some tips about what we're going to probably see moving forward, depending on how prominent this virus becomes in North America. So what are we talking about? So you guys know what coronavirus, or COVID-19, originated in China in late December. It was reported to the WHO in December 1st. There's some conversation about whether or not China knew about it earlier, but community transmission was a good person. Actually, that's Lori. She's like wandering around. There's some conversation about whether there was community transmission prior to it being reported to the WHO. Hey, Lori.
Hey,
Good. That remains to be seen. Lori really knows. Doesn't matter. So, COVID is a coronavirus. Coronavirus is an RNA virus. It's a zoologic virus. There are lots of coronaviruses in the world. There's 4 or 5 that cause a common cold. You've all had coronaviruses. You've seen coronaviruses. The reason it's called a novel coronavirus is this is a virus that humans have never seen before. So the way your immune system works in 10 seconds is it sees something, it develops an imprint, and when it sees it again, it has a really quick ability to replicate the things it needs to destroy, right? So in a novel virus, in a virus that immune systems have never seen, it may be something that's really not that big of a deal, but it has a much greater impact because your immune systems have never been exposed to this before. So that's something that's interesting to note. This is a novel virus. It was zoologic, so it came from animals. Coronavirus is a common virus in birds and mammals. And somewhere in China, nobody really knows where, there was a mutation that started causing this virus to jump to people. It probably happened multiple times from multiple animals to multiple people that started this nucleus of virus in Wuhan. So flash forward a couple months, you got a little nucleus of a few folks in Wuhan that had a virus, and all of a sudden you have 100,000 cases. So this is a pretty infectious thing. And despite some draconian stuff that's been done by China, we're really not slowing it down. So it's contagious, it's everywhere, it's here. The likelihood is that the reason, oh my God. Holy shit. The likelihood is that we already have virus in Colorado more than we have sensitivity to, right? So it's interesting that we have 8 cases, all 8 cases have travel history, but an important note is the only people we're testing right now are people with travel history. So it would be unusual for us to find someone that had the virus that didn't have travel history because we're not testing them. So we really have very low sensitivity and understanding of the spread here in Colorado right now. I got an email. The experts are probably are saying that we probably have more virus than we think we do, and so we need to start taking these precautions now. So we were sitting in this room and everybody's sort of thinking, I don't know, I think this is bullshit. There's people that are like literally digging holes in their backyards to go live in for the next year, all the way up to people that are licking things because I'm going to try to get the virus because it's not a big deal, right? So the information on this is all over the map, and what I'm here to do is sort of tell you about what the public health officials think. Now, my preface to that is I don't have an MPH, I'm not a public health official, I'm a paramedic, I've been a paramedic for a long time. That doesn't qualify me to give you any sort of expertise. This is all stuff that's been vetted by Jefferson County Public Health and Christine Billings and the women that work in the Office of Preparedness in the Public Health Department. So this isn't Brandon talking, I'm just a Christine puppet because she can't be everywhere. Because literally she's being asked to do these sorts of talks over and over again. So what's the epidemiology? So this thing, we're at about 106,000 cases now, so this is as of the 6th, so we're a couple days in, and we have a few thousand cases. 3,600 deaths worldwide. Today we have, as we understand it, eight cases that were diagnosed in Colorado, all presumptive positive. When you hear the words presumptive positive, that just means the CDC hasn't given the big check mark yet, by all intents and purposes, that those people have a positive coronavirus test. So those 8 folks all had travel history. They all were either in or in close contact with someone that was in a community spread area. And what do we mean by community spread? So community spread means the virus has taken hold in a population to the extent that I don't have to be in close proximity to you that has the virus in order to get it. I can be in close proximity to something that you were in close proximity to at some point. So all of a sudden, this virus there's enough of it that it's on surfaces and it's in places, and you go to a bar and your glasses and get washed, and all of a sudden now you have some potential exposure. So that's community spread. So in North America right now, we think there's probably community spread in Washington, Oregon, California, and Arizona. Those are the places where we've sort of really seen propagation of the infection. But I would submit that there are probably more places that have community spread. And as people move around and interact with each other, we're going to see more and more positive tests. The big issue is we need to have doing tests, which is a problem. So if you look at South Korea is doing 100,000 tests a day. They're not just testing sick people, they're testing everyone. And what they're developing is a model to understand what the disease is. So if I test everybody in this room and I know where you all live, and a couple of you are positive, even if you don't have symptoms, I can start to understand movement of the virus. That is not a step that we've taken in the United States yet because we don't have enough tests. So until we get to the point where we're actually testing, we're doing what's called surveillance testing, we're really not going to understand. And so it's even more important to us because we don't know where stuff is and who's sick and who's not, that we're hyper vigilant. It also is happening in the worst time of the year for this sort of stuff because who here has been sick in the last couple of months, right, with a respiratory virus. So we don't know the difference. And I would submit that potentially people have had corona and don't even know it because it presents similar to a bunch of other respiratory viruses. So a couple of interesting things. Median age is 59. That's pretty normal for coronaviruses. It's maybe a little bit skewed to the older side, but not too much. About 2% of patients are under 20, so it looks like kids and young adults, they're getting the virus. So there was an interesting study that came out last week. They thought that kids just weren't getting it. They're getting it, and they're becoming infected. They just don't have symptoms, or their symptoms are very mild. So, which is great. So those of you that have kids, school-age kids that are little petri dishes walking around all the time, they're going to get sick, but they're not going to have any complexity. There hasn't been a death or complex infection under 15, which makes me feel good. I have a 3.5-year-old. So this is the first thing that I thought of was, holy shit, this is going to be really scary. Oh, I'm being videotaped. I shouldn't say holy shit. So the transmission rate is 2.1. So there's a number called the R0, and it gets kind of complicated, but essentially there's a way that epidemiologists look at diseases and decide how infectious they are. For example, measles, which is one of the most infectious things we know about, its R0 number is 12 to 18. So 12 to 18 people are going to become infected with the measles if they interact with one person that has the measles, if it's an unvaccinated population, right? So this is 2.1. So for every infected patient, we expect 2.1 people to become infected. Now, what's important about that? It's more than one. So it is, I'm infected, and you get infected, and the two of you infect 4 people, and it's 4 of them infect 8 people, right? So we start exponentially growing the infection, which is a problem. The Ebola virus is also a 2. So just because the virus is a 2 doesn't mean it's particularly bad or good. There's this perfect storm that's existing with this virus that combines both being fairly infectious, but also not being that deadly. And so the cool thing about Ebola is it just kills people. And so you get Ebola, you're not symptomatic until you're not contagious until you have symptoms, and then all of a sudden you're dead. So the chances of you passing along to somebody else is pretty slim, right? It's really contagious, but you die so fast that you're not gonna have an opportunity to interact with a lot of people. This disease, you don't die. So you get it, you're infectious, and whoa, you're actually infectious before you have symptoms. So 48 hours before you feel sick, you're shedding virus. And so we don't even know, there are people that we're going to interact with potentially that aren't even ill, that are potentially shedding this virus prior to even having symptoms present. So that's why the testing stuff is so important. That aside, the mortality rate is a number that's really up for a lot of different discussions. So there's the last good study was 1,100 patients in China. It was published in the New England Journal, and it came up with a 1.4% mortality rate, which is about 15 to 25 times that of the flu. That's the lowest number we've seen. The World Health Organization now is saying 3 to 4% is the mortality rate. The problem with all these numbers is they don't take into account volume of patients that don't have significant infection. So if this whole room is infected, I can expect that some of you are gonna go to the hospital, some of you are gonna just have a bad couple days at home, and some of you will never know you're infected. And if I don't include those people that never know they're infected, then my mortality rate is artificially high, right? So most viruses, when we look back at them from a historic standpoint, the first number that comes out about mortality is usually artificially high. Take that for what it's worth. Nobody really knows because we just haven't included enough patients that were infected but were well. But we can say at 1.4%, this is a couple people out of 100 are going to die. The part of this that's really, really interesting is that it's significantly skewed to people over the age of 60. So over the age of 65 is 8%, over the age of 75 is 12%. So that means if you're over the age of 65, 1 in 10 patients are going to die. That's tremendous, right? That is way beyond the flu's mortality. The flu's mortality, between 15 and 25,000 people a year. If you take all this and crunch all the numbers and do the math, we're talking about millions of people in the United States potentially if the infection really takes hold. So there's a lot of media reports about how this is just the flu and the flu kills a lot of people and why are we worried about this because of the flu? Two things. This is not the flu, it's more dangerous than the flu. Two, we have a shot that deals with the flu. We don't have any shot for this. So the population is essentially unprotected. But 80% of the cases are mild. So most of the people in this room, if you're under the age of 65, if you don't have baseline long-standing health problems like diabetes, cancer, heart disease, lung problems, you have a very high likelihood of having a minor infection, not being hospitalized, feeling cruddy for a couple days, fever, flu symptoms, that sort of stuff, and then being right back in it. So the message here is we need to be really cautious about this because we potentially will be vectors that move this disease from people that are infected to people that are at risk. So that's what we do every day is interact with people that are sick. And if we have, really? If we have, into your jacket though, now I don't want to buy it. If we have these infections and we are either just asymptomatic or with low symptom and we're at work, and we're not protecting ourselves and we're not protecting our patients, we're potentially moving this disease from the person that we interact with to the cancer patient, to the elderly person, and that is going to be a huge risk for them. So we got to be really cautious about PPE and how we go about interacting with these patients. So 15% of patients then have severe symptoms, 5 are critically ill, and when I say critically ill, I mean ICU admittance with intubation and ventilation and really significant sorts of things. That 5% number somewhere in there is the mortality rate. I don't know. I think that it's open for debate. We'll probably see it be in the 0.5% range. I'm not an epidemiologist, but when you look at the historic fatality rates, when you look at what they thought of MERS at month 1 and then MERS looking back, it was significantly lower because there was just patients that didn't present. So it's still, if you look at the flu is less than 0.1% of mortality rate, and that is significantly less than 1.5, 2, 3%. We're talking an order of magnitude. So this is certainly a more dangerous thing, and it is absolutely a more dangerous thing for people that are on that high age range.